but you're just in time to join us for Straight Talk, where you get nothing but straight talk from our expert panelists and our host, Dr. Straight. And here he is.
Hey, it's Dr. Straight. Welcome back to Straight Talk. This episode we have something really interesting called Man in the Street. It's where we take a camera and a microphone, we head out, and we get our questions directly from you.
Hey, Dr. Straight. How do I know if I have allergies or a cold?
Well, that's a really good question, and one that we struggle with as providers sometimes answering the right way. If you have cold symptoms every year at the exact same time, well, you may not have a cold. The symptoms of the common cold and seasonal allergies are very similar, but they're treated completely differently. Seasonal allergies are caused by an exposure to an allergen. Usually it's something floating around in the air. The typical symptoms are itchy eyes, runny nose. You probably know this already. The good news is that there are over-the-counter remedies that work really well. So antihistamines, they have new ones now that don't make you sleepy. They work really well. There are other treatments like immunotherapy or getting allergy shots that can be very helpful. So if you're having and really struggling with these symptoms, please ask to see an allergist and we can see what different ways we can help you. If your symptoms are more along the lines of headache, sore throat, body aches, chills, that sounds more like a common cold. Because colds are caused by a virus, antibiotics aren't any use to you, so you don't need them. However, if your symptoms persist longer than they should, or they get worse, or you have a productive cough, those are good reasons to come in and see your healthcare provider.
And now we're ready for our second question. Question number 2.
Good morning, Dr. Straight. I have a friend, she have a clot in her leg. Can you tell me how that happened?
Blood clots are really designed to stop bleeding after a trauma, for example. But when they occur in the wrong spot, they can be very bad. In fact, 1 out of every 4 deaths is related in some fashion to blood clots. When a blood clot occurs in the leg, in the deep veins of the leg, we call that deep vein thrombosis, or DVT. When that clot occurs, it's blocking the flow of blood, which causes swelling, pain. There could be a noticeable difference between the size of one leg or the other, or even redness or discoloration. If that clot were to expand or break off, it can even move up into the lungs and cause something very dangerous or even potentially fatal called a pulmonary embolus. Most blood clots actually occur related to a hospitalization. Why is that? Well, the things that put you at high risk of having a blood clot occur in the hospital. It could be a major surgery that you're recovering from. You could be confined to a bed or relatively immobile, not able to move, and that increases your risk of blood clots. Delivering quality care and preventing harm is one of our main priorities here. Today we have the Deputy Commander for Inpatient Services, Colonel Mike Ludwig, to talk about all the things our team members do to help reduce your risk of blood clot while you're a hospital patient.
Thanks, Dr. Straight. The nurses and staff here in the hospital do a lot to try to avoid blood clots or DVTs. We're going to go over a few of those modalities now. One of the many things we do to prevent blood clots, Lieutenant Trevano is going to display here, and that is applying mechanical compression devices, which sequentially squeeze the legs to promote blood flow, thus avoiding blood clots forming in the leg. In addition to mechanical stockings, we can also do passive and active range of motion. This helps to contract the muscles to pump the blood back up to the heart so it doesn't remain stagnant and promote blood clots. Another intervention we do at the hospital is early ambulation. What this does is contract the muscles in the lower extremities so we can promote blood flow, thus avoiding stagnant blood, which can promote blood clots.
Thanks, Colonel Ludwig, that was great. Obviously the team does a lot of things to help reduce your risk, but what can you do at home? Half of these hospital-related events occur actually after folks leave the hospital. So you need to know what you can do at home to further reduce your risk. One thing is keep moving. So walking is best, but if you're going to be in place for more than a couple hours, you need to be up and moving around. The other is we have a heart to pump blood out to our limbs. We don't have a heart to pump blood back up away from gravity. And so you can help that with doing calf raises, whether you're in a chair or stuck behind a desk, or even if you're standing for too long, you can still raise yourself up on your toes, increase that muscle action to push blood up from where it doesn't belong anymore. That's about all we have for today, but I want to mention a flu vaccine. I think we're in the thousands now as far as how many we vaccinated. If it's safe for you to get the vaccine, you need to come in and get yourself and your family members vaccinated. It's super easy. In fact, let me show you how easy it is. Great, thanks for hooking me up, Jerry. You see how quick and easy that was? That's all we have for today. We'll see you next time. To Straight Talk.